Welcome, everybody. My name is Jim Taylor, Deputy County Administrator, and it's been my pleasure to have been working alongside you for the last 6 months. It's so nice to see so many of you here. Thanks for being here today. Since January, I have gotten to know many of you, some by name, some by face. You stepped up when you were needed, and our community is grateful. Many of you are Hanover residents, and some of you traveled from neighboring localities. One thing is clear, though, you are all part of the Hanover family now. In attendance, we have some special guests. I'd like to introduce members of our Board of Supervisors. We have the chairman of the board from the Henry District, Sean Davis. We have the vice chair from the Chickahominy District, Angela Kelly-Wisak. From the Ashland District, we have Faye Pritchard. From Cold Harbor, we have Michael Hersberg. And from the Mechanicsville District, we have Canova Peterson. We have a few members from the Ashland Town Council. I see Mayor Steve Trevette here. And a couple also members of Town Council who are actually in the back doing some cooking, John Hodges and Dan McGraw. We'll be hearing from Dr. Tom Frank from the Chickahominy Health District. Just want to thank him and his entire team from the Health Department. From the Hanover Sheriff's Office, we have Captain Kirk Schaefer. And from the Ashland Police Department, we have Captain Marie Kemp. And last but not least, from Food Lion, we have Samantha Pierce. And now I'm pleased to turn the microphone over to County Administrator John Budesky.
Good afternoon. It's truly my honor to be with you today. But if Mr. Fields, if you don't mind, we all did this work for our community. Mr. Fields is the last individual to get a shot at our clinic here today. Thank you. You've been a great sport, Mr. Fields. And by the way, he's a Caroline County resident, but we have now officially invited him to move to Hanover. And so we appreciate you being here today.
Thank you.
Folks, we have all stepped up in the past 14, 15 months in ways that we never expected we would need to do. You have done what we have needed to do for our residents in their time of need. And as your county administrator, I have been so humbled by the work of so many to make such a difference in our community. When we began this effort, we always do our work as a county in partnership with so many. And the folks at the Health District, I don't know if we can give them enough round of applause for all of their efforts to date. The health districts throughout the Commonwealth and this nation, we will never be able to share our gratitude enough. But when they came to us, and counties traditionally are not in the business, we rely on our health districts to provide primary medical care and prevention services and all the services that are under their umbrella. They came to us and said, look, we need some assistance. And that started early on with a call center. Many of you have volunteered at that call center. Over 20,000 residents were served at our call center. We were only able to do that with a great deal of support from many members of our community, but I really would like to recognize the leadership of Angela Baxter and our internal audit team, who really stepped up and led that effort with all of your support. We had so many folks from many different disciplines that just said, how can I help? And the call center was where we started with this effort outside of what we were doing prior to beginning our vaccination efforts. To date, and I really hope you take in some of these numbers, the work that we were all able to do together to serve our community over 51,000 residents received their shots right here in this building. In total, at all of the clinics that we were able to offer, not only here at Randolph-Macon and throughout our community, over 60,000 Hanover and Chickahominy District residents received services because of your support. As the county administrator, I often lean on our employees to go above and beyond and make tomorrow better than we found today. And our employees had stepped up in many ways that I will forever be grateful for. I'm also very proud. Jim Taylor took this initiative on very early on behalf of the county and county administration. Jim, I'd like to thank you for all of your work. This also has been guided on a day-to-day basis on the county side from our leadership at our fire and EMS team. Many of them could not be here at this time because they are recognizing one of their very own. But I would really greatly appreciate a round of applause for all the fire and EMS professionals that served our community during this time of need. There were many folks, and I know we are bound to miss someone or a group that stepped up during this time, but I also see Marcy from Parks and Rec in here. Many of you dealt with Marcy throughout this process. Marcy, thank you. You always step up when we need you, and this was no less, so thank you so much. As I started our conversation as a partnership with our health district, we are very proud to have been able to assist that team. We are also very proud of the efforts of Food Lion. You know, this facility was sitting vacant. When we reached out to Food Lion, they provided this facility at no charge. All we paid was the rent, so we'd like to thank Food Lion. The other piece that I would be remiss if I did not mention, there's a lot of other merchants and businesses throughout this great Ashland Junction retail center. They were very patient with us throughout this entire period of time. We encourage you to continue your patronage of those businesses beyond today's event, but thank them for their patience. As I wrap up, I would just, I work for 7 very committed individuals to this community, and that is your Board of Supervisors. From day one, we did not have conversations about how much will this cost. The conversations all really rallied around what is best for our community. What can we do to help? And they have been champions from day one. And so it is my honor to introduce our chairman of the board, Mr. Sean Davis.
Thank you, John. One of the things that makes Hanover an incredible place to live is our spirit of community. One of my duties today, and I have 2, and that's to recognize a lot of folks, but I think my first duty is to really explain, now that we're here, the tremendous amount of logistical, administrative work that went into making this happen. Sometimes when you do something successfully, you don't realize what goes on in the background, and that's probably part of the sign of success. But this had to happen extremely quickly. You have 7 board members who have 7 different ways of thinking sometimes. As chairman, I think I know that better than anybody. But the reality is everybody wants to do the right thing, but people have different thoughts, they have different ideas. And in this case, there was a unified thought process, and that is, get it up, get it running, get vaccines to our community, whatever that may take. So I've got some folks on the board I want to recognize because, it's easy to be critical of government, and I am myself. But when something's done right and you have people come together, it's important, I think, for the community to know that the demands you place on your government were acted on, and they were done in accordance with what you wanted done. And I think it's important for you to know that your demands were met. We're fortunate on the board, folks like Mr. Herzberg, who have a tremendous amount of energy extremely connected to his district in Hanover, was there every time I called and said, Mike, here's where we're going. Any issues, any questions? No, you got Mr. Peterson, who absolutely is probably the best on the board with project management. Decades and decades of experience in project management. Ms. Kelly Wiesack, serving as the vice chair, would take a call anytime, day or night, and would help me administratively work with Mr. Badesky. So those were extremely important. And then Ms. Pritchard. Ms. Pritchard allowed us all to come here today for a few hours here in Ashland. She said it was okay. But I'm telling you right now, this facility and working with Food Lion, and thank you so much. I can't tell you, yeah, amazing. I said, Faye, whatever it is that you think needs to be done, just go do it. I mean, whatever it is, I don't know what has to be done to make this happen. And come here, Steve, Mayor Trevette, it was just amazing. So when you hear that Hanover and Ashland are butting heads, that's not true. People came together. This would not have happened without Faye and Steve, Town Council, the Board of Supervisors, coming together on behalf of the citizens. So I am just so grateful. And Faye, I can't thank you enough for all the work that you put into it. And as y'all know, Faye is not a shrinking violet, right? So when you turn something over to her, you expect it to get done, it does. So thank you, Faye. We appreciate it. Thank you, Steve. There are a lot of folks that need to be thanked. This was a huge priority. Mr. Badesky and his staff did a phenomenal job. But I need to go through some folks that y'all may not know were integral and instrumental in this. So we have the Episcopal Churches of Hanover County provided $50,000 in grants from the Newman Fund to the clinic to help us with our operations. Sherwin-Williams, yeah. Sherwin-Williams immediately came in and donated paint when we first opened to spruce this place up. Reynolds Community College throughout the Central Virginia and Richmond area partnered with the Health District to provide vaccinators. Chickahominy Health District, this was y'all's thing. And man, worked tirelessly to serve the residents in this district. And I just want to we call this a Hanover Vaccine Center. This is a Chickahominy Health District Vaccine Center. We've got folks from all over the place coming here from Caroline, and that's our privilege to be able to serve that large population. CERT, the Community Emergency Response Team, provided massive amounts of volunteers, both at the call center and the vaccine center. The town of Ashland, again, could not have done it without their support from day one. And that's not day one when we opened. The town of Ashland was here on site, ready to rock and roll. And when we opened this up, so much work had gone into it already. So again, to the mayor, I am extremely grateful, and this community is grateful. So thank you for that partnership. Hanover County Public Schools, a lot of folks don't know that we diverted many of our nurses and folks that had healthcare backgrounds from the schools and brought them in here. And this was their point and place of duty every day to provide vaccines. Henrico and Chickahominy Medical Reserve Corps. A lot of folks don't know about this, but that is a massive group of volunteers, and the MRC volunteers, they made this happen by just filling all the vacancies that we needed. Again, Food Lion, I will tell you, government doesn't always have the solutions. Partnering with the private sector is where we're best at making things happen, and we couldn't have done it without y'all. So again, thank you to Food Lion. Colonel Hines and his office, along with Chief Goodman with the Ashland Police. A lot of folks don't know, but we had a mass vaccination protocol in place for the flu. Years ago, we had done some dry runs. A lot of folks didn't know that. We took that and just changed the name to COVID and used a lot. So these folks were out training all these years for this, not knowing this was going to happen. They were immediately able to turn the switch and make it happen for COVID. And then we had to reach out to community groups, churches and organizations, and say, we need your help talking to your constituency, to your members, to the people that you communicate with on a daily basis. And we were grateful for the many churches. The Hanover NAACP helped us with making sure that our minority vaccine efforts were amongst the highest in this region and even throughout the state. So I want to thank the Hanover NAACP. Randolph-Macon College, where my son is going to be a junior, as long as his grades continue to be what they are. Randolph-Macon College had the very first vaccine center. So we're so grateful to them. Ashland Kiwanis Club for grilling today, so thank you for that. And can I take just a moment, John? So we come up here, you've got 2 board members here every Friday, working inside the vaccine center. I come up one day and I see my county attorney out there helping park cars, and I look back here and I don't think there's anybody in the administration office today. They're out here. These are the folks who come out of their offices to do things. If you have a problem with your assessment, I want you to know the assessor's over there. He's more than, he's just as a side note, board has nothing to do with assessments. But these are folks, these are department heads, and they've given their staff time and encouraged their staff to come out and support here. I think we have our chief building inspector. That is Hanover. I want to thank the Master Gardeners Club, answered so many calls, and we're just thankful for them in assisting us getting folks here. Dash provided numerous free rides to the clinic. And again, to the great employees of Hanover County, the majority of our employees are actually Hanoverians, and it means a lot. So they're not doing this because they're on the clock. They're doing this because they're serving their friends and their neighbors. So we are so absolutely grateful for the employee base that has come out to serve what we as a board see as a joint constituency, the citizens of Hanover County. With that, I'll close and say our goal was to provide the opportunity for every Hanover County citizen who wanted a vaccine to be vaccinated. We believe that goal has been met. You have communicated with us that you believe that goal has been met, so that's why we're here today. So at the end of today's event, I'm going to ask Mr. Badesky to make a presentation in recognition of those efforts. At this time, I want to turn it over to Dr. Frank, the calm spirit behind the storm sometimes. So Dr. Frank, thank you.
Yeah, thank you, Mr. Davis. Good afternoon, everyone. I hope you're all enjoying yourselves. For me, this all began on March the 7th of 2020, and some of you may remember that day. I was at a UVA basketball game, and I was elated that UVA had just beat Louisville in basketball at the John Paul Jones Arena. That was an awesome game. However, my elation was totally deflated when I received that dreaded public health emergency alert in the evening. Virginia had just confirmed its first case of COVID-19. I turned to my best friend, who's a family doctor in Charlottesville, and I told him that life in Virginia will never be the same. Take my word for it. And I was right. Life in Virginia has never been the same for me or for you all or for our citizens. At that time, back in March of 2020, I could never have imagined that just 9 months later, we would have not one, but 2 vaccines effective against COVID-19 ready to be administered 9 months later after that first case in Virginia. And not just any vaccines. These vaccines are 90% effective, over 90% effective at preventing COVID-19 infection, and nearly 100% effective at preventing hospitalizations and death. I never could have imagined that back in March of 2020. A truly miraculous feat involving a lot of smart people in the United States. So that takes us to December 30th of 2020. Chickahominy Health District opens up its first vial of Moderna vaccine, and we vaccinate the first 10 people in the health district. I would call them guinea pigs, actually. And this was in our tiny little lab over at the health department down the street here. So we all did it well. We survived. And the following week, we decided, hey, it's time. It seems to be safe on us. It seems to be safe throughout Virginia so far, in the United States so far. Let's go ahead and let's start this campaign. So the very next week, we vaccinated 164 people at the Hanover Department of Social Services in their large conference room, which is fairly large, but 164 people was actually really tight. So we quickly realized this wasn't going to be big enough. We had to expand. So we expanded to Randolph-Macon College, Brock Recreation Center, where we started vaccinating folks on a mass scale. So that first week, which was the third week of our campaign, we vaccinated 615 people. As demand for the vaccine increased, however, we knew that we needed an even larger venue. And so with extensive planning on the part of Hanover Fire EMS and Hanover County, and the help of so many of you all and so many of our partners in the community, we came up with this place, and thanks to Food Lion for offering this place up. The Ashland Junction Food Lion became our mass vaccination center, and where we held our first event on January 29th, which was vaccinating the Hanover County public school staff. So since then, this clinic has really taken off exponentially. We, week after week after that, we began vaccinating 600 people a day, and then 800 people a day, and then 900 people a day, and then 1,000 plus people per day. And according to my records, we held our most productive clinic on March 26th, when we vaccinated 1,141 individuals. Unbelievable. Thanks to everybody here. So now, I've been to larger clinics in Virginia. I've been to a number of clinics all around the region. And I can tell you that there are larger clinics than Food Lion. For example, Richmond International Raceway. But let me tell you what Richmond International Raceway has. They have not only the MRC, the Medical Reserve Corps, which we also have, but they had help from Hanover Fire EMS. They had help from Goochland Fire Rescue, from Richmond Fire, Henrico Fire, Westwood Pharmacy, the Virginia National Guard. They had 30 vaccination tables running 8 a.m. to 8 p.m. But I have never been to a more efficient and more effective clinic than this one right here at the Ashland Food Lion. So now, being the health director here at Chickahominy, you might say I'm a little biased, and I probably am. But when you start hearing this same thing, this same message from Virginia's Secretary of Health and Human Resources, from the Secretary of Public Safety, and from my own boss, Deputy Commissioner of Health, it adds a little bit more credence to that. This is effective and efficient clinic, and it is the gold standard in Virginia COVID vaccination. It really is. So here we are today, having conducted our 70th clinic with over 51,000 doses of COVID vaccine given out. You just heard Mr. Badesky, and over 60,000 doses here in Hanover County, inside and outside this clinic. And I want to echo all the kudos given by Mr. Badesky and Mr. Davis. There's so many people that contributed to the success of this clinic. I can't even begin to thank them all. But I did want to add a few. I wanted to add the Virginia State Adjunct Employee Workforce. They're called the AEWs. These are Virginia State employees who asked permission from their supervisor if they could go and help out at a vaccine clinic throughout Virginia. And we, here in Hanover, in the Ashland Food Lion, we had the most number of AEWs deployed throughout the state of Virginia, the Commonwealth of Virginia. So I don't know what the total numbers were. Caitlin Hodge has those numbers, but I remember it started off with 1, and then 3, and then 15, and then over 20, and then over 30. We've had probably more than 40 or 50 of those state workers helping out at the same time. And then Team Rubicon. Some of you may know Team Rubicon. They're a group of veterans from all over the nation. They're veteran volunteers who decide they're going to help out wherever they're needed in the community. So Team Rubicon sent a team down here to help out for a couple of weeks. They helped out with the traffic control outside. So I wanted to thank them as well. And of course, we all know how indispensable the Medical Reserve Corps has been for the COVID vaccine campaign throughout Virginia. But in particular, the Chickahominy, Henrico, and Richmond MRC volunteers were particular superstars. With 883 volunteers, before today that is, so 882 volunteers had contributed a total of 15,042 hours, all led by our very own Alyssa Lewis. So I wanted to thank Alyssa. Alyssa, I don't know if you're here, but if you are, raise up. I think Alyssa may not have been able to make it today. I also wanted to thank our health department's core vaccination team. I would be remiss if I didn't point them out and name them as well. I wanted to thank our vaccine leaders, and you can hold your applause till the very end if you don't mind. But I wanted to thank our vaccine leaders, Karen Stalzer, Cindy Moss, and Abby Nimitz, our logistics officers, Johnny Day and Mason Earp, our planner, Steve Reichel, our lead registrars, Janae Winston and Hayden Osborne, our data entry leader, Penny Giles, but many, many more contract temps that joined our team. I'll mention a few of them: Dana Steele, vaccinators Dana Steele, Bob Carson, Jill Capadia, Nick Cass. We had data entry folks and registrar helpers, Joan George Sipe, Amanda Orchowski, Keelia Johnson, Cody Salou, and many, many more. I can't name them all, but my health district went from 43 people and more than doubled in size since COVID campaign started. And these are the contract temp workers who came and helped us out throughout. I also wanted to mention Caitlin Hodge. Caitlin stepped up almost a year ago now to become the leader of the Chickahominy COVID response team. I don't know if you all know that, but Caitlin is actually leading the Chickahominies COVID response efforts. And that includes not only the vaccine team that I just mentioned, but it's also, she's in charge of the containment team and the community mitigation team. And so, Caitlin, I wanted to thank you for all of your efforts in helping us out. Finally, I have one more person to acknowledge, and that is Rue Harris. Rue, many of you know, is our former county administrator, and Rue is here today. I think I see him over here. Hey, Rue. So Rue, our former Hanover County administrator, recently retired, came up to me one day and gave me a call and said, "Hey, Dr. Frank, I want to know how I can help out. You know, COVID has hit us, and I just want to know how I can help out. I'll help you out in any way you want. Just let me know what I can do." And since then, I can tell you, Rue Harris has joined the Chickahominy Henrico Medical Reserve Corps. He's been at many, many events. You'll see him all over the floors doing any number of different positions as an MRC volunteer. But more than that, he also joined my team, my core COVID vaccination team, and helped us with strategic planning. And he became a key liaison with not just Hanover County, but all 4 of the counties in the district. So that includes New Kent County, Charles City County, and Goochland County. And Rue became the primary liaison with our leadership over there, kept us on track, kept us focused on the strategy and the mission, and contributed so much towards our success in this campaign. I wanted to thank you, Rue, for just being there and helping. And totally as a volunteer, by the way. He volunteered his time. So thank you for everybody. These are just a few of the people, but I want to thank everybody out here who's contributed to this campaign. Now, I see a lot of yellow shirts, and I see a lot of MRC volunteers that I've become very familiar. Joe, thank you for coming to so many of our vaccination events, not only here, but all over the district, and vaccinating so many people. We've had, I think we counted over 10 MRC volunteers that actually gave well over 100 person hours of effort, contributing to that number that I gave you earlier. So thanks, everybody. I think everybody deserves a big round of applause here. So thank you. And now I'm going to turn it over to John Badesky, who's got another presentation.
Thank you, sir. As I wrap up, I know some folks are coming in and we're going to be switching over, so 250 more of your friends are about to come into this building that will get the same presentation. But on your way out, just as a small token of our appreciation, just wanted to make sure each of you are going to leave with a charger that says "Volunteers Power Our Community." This is so you can now go recharge after all of your hard work. And a water bottle that says "I made a difference in Hanover County," and you truly have. And so thank you so much. Thanks to all of you.